Hey there, John here. I just wanted to give an update about where we are with everything. So I was able to meet for my post-op appointment with my surgeon today, which was amazing. The visit went pretty well. He said my incisions were healing great. He was really happy with my progress. And so we're basically just sticking the course for that. Everything looks right on schedule, but still in the healing phase. And so really happy to have that appointment today. In addition to that, I was able to meet with my oncologist yesterday, who went over my treatment plan moving forward, which I'll just read from my report here that my stage 3B colon cancer, they're recommending adjuvant chemotherapy with FOLFOX, which will be all intravenous medications that will be given every 2 weeks for 6 months. And the F5FU infusion requires continuous infusion over 2 days with a portable pump. So I will be getting a port installed on my chest in a couple of weeks so that I can bring that pump home with me for 2 days after I get my injections, depending on whatever day we decide is going to be that day. Not gonna lie, I'm a little scared and a little unsure of how to feel. I'm still kind of processing what that's gonna look like, especially with the side effects. I think I'm most concerned with just, feeling terrible, losing my hair, what little I have left, and just, the whole process of what that's gonna look like. So I'm just trying to figure out how to process through what that means for me, and kind of grieving a little bit my life before all of this. For anybody that's gone through that, and I'm sure you can kind of relate to that. So just really anxious to kind of get this process started so that I can make it through whatever I need to make sure that everything is good for me. Moving forward, I'm going to have to continue to have CT scans for every 6 to 12 months for 5 years after chemotherapy, and a colonoscopy 1 year after surgery. And then because I have Lynch syndrome, I'll need an EGD, or an upper endoscopy, every 2 to 4 years. And I'll just be arranging that with my team as we go. So I'll keep everyone posted whenever I learn more, especially once I get have the port installed, and kind of keep everyone posted. Just to follow up as well, I did ask the oncologist about the PET scan. He assured me that that was not something that I needed at this time, and that based on everything that they had, the CT scans, and given the fact that I had 0 margins whenever they removed the section of my colon and all these other things, that that we didn't need that at this time. And I'm trying to think if there was something else. I think some people have brought up the Signatera blood scans, and so we're not going to be doing that at this time either. But I'll continue to ask my radiology team, as well as my oncologist, if that's something that's going to be needed. So if you have any other suggestions, or just advice of how that I can manage or get through this, I'd love to hear for anyone that's been through this before, what their experience has been. I understand that everyone's experience is quite different, but I'm really anxious to understand kind of like what I'm in for. So if you have any suggestions or advice, or just supportive comments, I really appreciate that. And so we'll talk soon.